is Alexis Officer, and today I'm going to be telling you the reasons why I think that ambulance transportation in the U.S. should be cheaper. And here's my audience. Today, people are calling ambulance transportation a financial gamble. In 2010, the U.S. Government Accountability Office found that the average cost for a ground ambulance was $429, ranging anywhere from $224 to $2,204. And it varies a lot by state and city. According to one study, 71% of ambulance providers don't take the patient's insurance. They also found that 79% of patients could get a surprise bill for an ambulance ride. And 4 out of 10 Americans would need to borrow money or take out a loan to cover a $1,000 emergency bill, according to senior reporter Amanda Dixon. Some of the cost factors for ambulances are the type of ambulance that takes you, the medical services that they provide, and the distance traveled. It also determines a lot the city and the state that the ride was taken, and whether the service was publicly or privately funded. It's the private insurance system that makes healthcare in America so expensive. Another factor is cost shifting, which means some who pay more or who make more money have to pay more to make up the differences for others. In 2016, the average cost per ground ambulance in Georgia was $824, while in New York it was $752, and in Texas $930. The difference in price of average cost between cities in the same state was insane. In Florida, Lake City, Florida, just 2 hours apart from Tallahassee, Florida, there was over a $200 price difference in transportation. Dr. Karan Chabra, resident at Brigham and Women's Hospital, explains how surprise medical bills happen. In his words, surprise medical bills happen when you get medical care from somebody who you were unable to choose from, and that person or that provider doesn't take your insurance. So in those situations, if they don't participate in your insurance plan, they can charge you whatever they want to be paid. The potential surprise bills for an air ambulance comes in at a staggering $21,700 per ambulance ride. Americans don't consume more healthcare than other countries paying less than us, but we pay twice as much for the same services. It's becoming a moneymaker for the government, and it needs to be fixed. Because saving humans' lives should be the main focus while being transported to the hospital, not the fear of being able to afford the bills. Nowadays, people are even calling Uber to take them to the hospital.
I'm here in an Uber with my driver, George. And you know, millions of people take rideshare every day to get to restaurants, the gym, even appointments. But now a new trend is emerging. Some sick people are calling an Uber or Lyft instead of an ambulance to get to the ER. It's a sign of the times. More and more people calling an Uber or Lyft for a ride to the emergency room. Skipping the more expensive and sometimes slower to respond ambulance.
You think you might be having a baby.
Yeah.
And you took an Uber car.
Well, I didn't have a ride.
Yeah. Okay.
So...
You don't want your water to break in your own car. Yeah.
No. Drivers say it's becoming a trend. Have you ever taken anybody to the emergency room?
All the time.
All the time.
All the time.
Chandra Steele knew she needed to get to the ER fast.
I was having some internal bleeding.
A New Yorker, Chandra tried hailing a taxi, but someone else grabbed it first. So she called for an Uber.
It's scary that we're worrying about the cost of the medical bills that are going to come after that we might not even know about, when all we should be worrying about is getting to the hospital, getting taken care of, and getting out. There's families all around the world scared to go to the hospital because they know that their insurance isn't going to be taken and that they could be charged potentially whatever the hospital wants to charge them. Some ambulances will take patients 2 miles and charge them $3 grand. It's insane. And sometimes they didn't even get much medical assistance in the ambulance ride. We really need to think about how much we're charging, because our lives should matter more than dollar signs. And to the US, that's what it seems to look like right now. We pay about the same as a lot of other good healthcare countries, but our services cost a lot more in the long run because of all these unexpected bills and all these bills that the hospital charges. Thousands of dollars just to get transported, and then thousands more at the hospital is insane. We need to be caring more about each other's lives than the cost of the service getting transported. Thank you.